You go to bed tired, you turn off the lights, pull the covers up, and expect your body to finally get the rest it needs. But what if one small thing you do during those quiet nighttime hours is putting extra stress on your heart and blood vessel? It may not feel dangerous. You may not even realize you're doing it. And that is exactly why this sleep mistake deserves your attention. I'm Dr. Calvin Stone. And when we talk about stroke prevention, most people immediately think about blood pressure, cholesterol, smoking, or diet. Those things certainly matter. But sleep is often treated as if it is simply about feeling rested the next morning. Your cardiovascular system doesn't see it that way. While you sleep, your heart, blood vessels, breathing, and nervous system are still working together. And when that nighttime process is repeatedly disrupted, the effects may extend far beyond daytime tiredness. Now, I want to make something very clear. One bad night's sleep does not mean you're going to have a stroke. And having a particular sleep habit does not automatically mean you are in danger. The important question is whether a seemingly harmless nighttime pattern is happening over and over again, and whether it is interfering with healthy sleep or normal breathing. Here is the mistake I want you to think about tonight. Ignoring repeated nighttime breathing problems because you assume they're simply part of getting older. Maybe you've been told that your snoring is harmless. Maybe you wake up with a dry mouth. Maybe you suddenly find yourself awake several times during the night, or perhaps someone in your family has noticed that your breathing becomes unusually loud, irregular, or even seems to stop for brief periods while you're asleep. You might brush it off. I've always snored. It's just because I'm getting older, I'll deal with it later. But this is where the story changes. Repeated interruptions in normal breathing during sleep can cause your body to react as though something is wrong. Your oxygen levels can fluctuate. Your nervous system can become activated, and your cardiovascular system may experience repeated stress. One condition strongly associated with this pattern is obstructive sleep apnea. And here's the part many people miss. You don't have to remember waking up for these disturbances to matter. You can be completely unaware that they're happening. Imagine a man in his early 70s who goes to bed at 10:30 every night. He believes he sleeps for 7 hours, but his wife notices something he doesn't. Every so often, his snoring becomes very loud. Then everything becomes quiet for several seconds. She waits. Eventually, he takes a deep breath and starts snoring again. By morning, he has no memory of any of it. He simply thinks, I didn't sleep very well. That's an illustrative example, not a diagnosis, but it shows why nighttime symptoms can be easy to overlook. And there is another clue that deserves attention. If you wake up repeatedly during the night gasping, choking, or feeling as though you cannot catch your breath, don't simply assume that's normal aging. Those symptoms are worth discussing with a healthcare professional, because the goal isn't to frighten you. The goal is to catch problems that may be treatable before they become part of your everyday life. And there's something else about sleep that makes this especially interesting. It's not only how long you sleep that matters. The quality and regularity of that sleep matter too. So, if you've been focusing on getting into bed at the right time, while completely ignoring what happens to your breathing once you're asleep, you may be looking at only half of the picture. And that brings us to an important question. What exactly happens inside your body when normal breathing is repeatedly interrupted during the night? And why could that matter for your blood vessels and stroke risk? When breathing is interrupted during sleep, your body doesn't simply sit there and wait for the next breath. It reacts. Your brain senses that something has changed. Your nervous system can shift into a more alert state. Your heart rate may change, and your blood vessels can tighten. If these interruptions happen repeatedly throughout the night, your cardiovascular system may be exposed to this cycle again and again. Think about what that means. Instead of spending the entire night in a steady period of recovery, your body may repeatedly move toward a state of alertness. You may never consciously wake up, but your body can still respond. This is one reason sleep apnea has become an important topic in cardiovascular health. Sleep apnea is associated with conditions such as high blood pressure, and high blood pressure is one of the major risk factors for stroke. That connection matters, but we need to be careful with the wording. Having sleep apnea does not mean a stroke is inevitable, and treating a sleep problem isn't a guarantee that someone will never have a stroke. What it does mean is that repeated nighttime breathing disturbances are worth taking seriously, especially if you already have cardiovascular risk factors. Now let's look at a very common misunderstanding. Many people think sleep apnea always looks dramatic. They imagine someone who snores so loudly that the entire house can hear it. But symptoms can be much less obvious. You might wake up with a headache. You might feel unusually tired despite spending plenty of time in bed. You might have difficulty concentrating during the day. You may wake several times to use the bathroom. Or you may simply feel that your sleep never seems refreshing. Sometimes the person who sleeps beside you notices the problem before you do. They may say, "You stopped breathing for a moment." That sentence should not be casually dismissed. And here's something particularly important for adults over 60. As we get older, it becomes easier to blame almost every change in our sleep on age. You wake up earlier. You sleep more lightly. You feel tired during the afternoon. You snore more than you used to. And you tell yourself, "Well, I'm getting older." But aging and sleep disorders are not the same thing. Some changes in sleep are common with age: pellucid, loud snoring, witnessed pauses in breathing, repeated gasping, or significant daytime sleepiness deserve a closer look. There is also another nighttime habit that can make this problem harder to recognize. Using alcohol close to bedtime. Some people believe a drink before bed helps them relax and fall asleep faster. And while it may make you feel sleepy initially, alcohol can interfere with sleep quality and can worsen breathing problems in some people, particularly those who already have sleep apnea. So the question isn't simply, did I fall asleep quickly? The better question is, was my sleep actually restorative? That distinction can change how you look at your nighttime routine. You could fall asleep quickly and still have fragmented, poor quality sleep. You could spend 8 hours in bed and still wake up feeling exhausted, and you could assume the problem is your age when something else deserves attention. Now, there is one more mistake I don't want you to make. Don't respond to this information by becoming afraid of going to sleep. That's not the message. The message is awareness. If you have repeated signs of disordered breathing, the next step isn't to diagnose yourself from a YouTube video. The next step is to bring those symptoms to your healthcare professional. A clinician can determine whether further evaluation is appropriate, and sleep testing can sometimes be used to identify sleep apnea. And if you already use a prescribed treatment for sleep apnea, don't stop or change it on your own. Instead, talk with your doctor or sleep specialist about any problems you're having with it. Because when it comes to stroke prevention, there is rarely one magical solution. It's usually the combination of several small, consistent decisions: controlling blood pressure, taking prescribed medications correctly, staying active when appropriate, eating a balanced diet, avoiding tobacco, and paying attention to sleep. And there is a reason I'm emphasizing that combination. You don't need to become obsessed with every minute of your sleep. You need to recognize the patterns that deserve attention. So tonight, before you turn out the lights, ask yourself a simple question. When I wake up in the morning, do I actually feel restored, or have I simply spent several hours unconscious while my body struggled to get the quality sleep it needed? If you don't know the answer, that's okay. Sometimes the most useful information comes from the person sleeping next to you. And that observation can lead us to another important piece of the puzzle. The nighttime signs that are easy to overlook, but may tell you that your sleep deserves a closer look. There are several nighttime clues that can be surprisingly easy to overlook. One of the biggest is waking up with a pounding or racing heart. Now, an occasional change in heart rate can happen for many harmless reasons. Dreams, stress, caffeine, medications, and even simply changing position in bed can affect how your heart feels. But if you repeatedly wake up with your heart racing, especially when it happens alongside loud snoring, gasping, choking, or witnessed pauses in breathing, boost. That's a pattern worth mentioning to your healthcare professional. Another clue is morning headache. You might think you simply didn't drink enough water the day before. And sometimes that may be exactly what happened. Boost. But if morning headaches happen repeatedly, particularly when combined with unrefreshing sleep or loud snoring, they can be another reason to ask whether your nighttime breathing deserves evaluation. Then there's daytime sleepiness. Boost. This one sounds almost too ordinary. You sit down after lunch and feel like you could fall asleep. You become tired while watching television. You struggle to stay focused during a conversation. Boost. Or you need several cups of coffee just to feel like yourself. Many older adults simply accept this as part of aging. But excessive daytime sleepiness isn't something you should automatically write off as just getting older. Boost. There can be many causes, including medications, sleep schedules, mood, medical conditions, and insufficient sleep. The important point is that persistent, unexplained sleepiness deserves attention. Boost. And here's a simple observation you can make without buying anything or performing a complicated test. Pay attention to how you feel when you wake up. Do you wake up feeling refreshed? Or does it feel as though you barely slept? Boost. Do you wake with a dry mouth? Do you have a headache? Are you getting up repeatedly throughout the night? Does your partner complain about loud snoring? Have they noticed pauses in your breathing? Boost. These clues don't diagnose sleep apnea, but they can help you recognize when it's time to have a conversation with a healthcare professional. And there is another part of the sleep equation that deserves attention. Boost. Your sleeping position and nighttime environment. For some people with obstructive sleep apnea, boost. Sleeping on the back can make airway obstruction worse because gravity can allow tissues in the upper airway to move in a way that narrows the passage. Boost. That doesn't mean everyone should suddenly force themselves to sleep on their side, and it certainly doesn't replace proper medical evaluation or treatment. But if you've already been told that you have sleep apnea, boost. Your healthcare team may discuss positional strategies as part of your overall management. This is where I want you to notice something. We're not talking about one magic trick. Boost. We're talking about understanding what your body is doing while you're asleep. That's a very different approach. And it brings us to a mistake that can be even more damaging to your sleep than you might expect. Boost. Treating chronic sleep problems with random solutions instead of finding the reason they're happening. Maybe you take an over-the-counter sleep aid because you're waking too often. Boost. Maybe you have a nightcap because you think alcohol helps you stay asleep. Maybe you simply tolerate severe snoring because you don't want to make a doctor's appointment. But the question should be, boost. Why am I sleeping this way in the first place? That's a much more useful question, because if the underlying issue is sleep apnea, insomnia, medication effects, restless legs, frequent nighttime urination, pain, boost, or another condition, simply forcing yourself to sleep may not address the actual problem. And this matters because good sleep isn't just about making tomorrow easier. Boost. Sleep is one part of the larger picture of cardiovascular health. Your body needs periods of rest and recovery. So if something repeatedly disrupts that process, it's reasonable to take a closer look. Now, boost. I want to pause here and ask you something. Have you ever been told that you snore loudly? Or has someone ever told you that you seem to stop breathing while asleep? If so, you can share that experience in the comments. Boost. You may discover that you're not the only person who has noticed this. And if you know someone who constantly says, I sleep fine, despite severe snoring and daytime exhaustion, boost. This is one of those situations where a gentle conversation could be worthwhile. Not to frighten them, not to diagnose them, just to encourage them to ask the right question. Boost. Because sometimes the most important health warning isn't a dramatic symptom, it's a pattern that keeps repeating quietly in the background. And there is one final piece of this puzzle we need to put together. Boost. What you can realistically do if these warning signs sound familiar, and how to protect your cardiovascular health without turning bedtime into another source of stress. If several of the signs we've discussed sound familiar, boost. The answer isn't to panic tonight. The answer is to become curious about your own sleep. Start by paying attention to patterns. If you sleep beside a partner, ask whether they have noticed loud snoring, pauses in breathing, choking sounds, or unusual movements during the night. If you sleep alone, consider whether you regularly wake with headaches, a dry mouth, unusual fatigue, or the feeling that your sleep never truly refreshed you. You can also keep a simple sleep record for several days. Write down when you went to bed, when you woke up, how many times you remember waking, and how you felt the following morning. This won't diagnose a sleep disorder, but it can give you useful information to discuss with your doctor. And if your healthcare professional recommends a sleep evaluation, don't look at that as bad news. Think of it as information. Knowing what is happening gives you more options than simply wondering about it. If sleep apnea is diagnosed, treatment depends on the individual. A healthcare professional can discuss the appropriate options with you. For some people, treatment may involve positive airway pressure therapy. For others, different approaches may be considered depending on the severity and cause of the problem. The important thing is not to choose a treatment based on a television advertisement, social media video, or a promise that sounds too good to be true. Get the problem properly evaluated. And remember something especially important if you're taking medications. Never stop a prescribed medication or change its dose because you think it may be affecting your sleep. Bring the concern to your doctor or pharmacist instead. They can help determine whether a medication, timing, dosage, or another factor could be contributing to the problem. Now let's zoom out for a moment. Stroke prevention isn't built around one perfect night of sleep. It's built around the habits and medical care you maintain over time. Now your blood pressure. Take prescribed medications as directed. Don't smoke. Stay physically active in ways that are appropriate for you. Choose a balanced eating pattern. Maintain regular medical care. And don't ignore persistent sleep problems simply because they happen at night. There is something empowering about that list. Most of these aren't dramatic changes. They're ordinary decisions repeated consistently. And you don't have to change everything tomorrow morning. Choose one thing you can realistically improve. Maybe that's making an appointment to discuss your snoring. Maybe it's asking your partner what they've noticed while you're asleep. Maybe it's finally addressing a sleep problem you've been tolerating for years. Or maybe it's simply keeping track of your symptoms so you can have a more useful conversation with your doctor. One more safety point is important. If you ever experience sudden weakness or numbness, especially on one side of the body, sudden trouble speaking or understanding speech, sudden vision problems, severe unexplained dizziness, loss of balance, or a sudden severe headache, don't assume it's because you slept badly. Those can be warning signs of a stroke and require emergency medical attention. In the United States, call 911 immediately if you suspect a stroke. Don't wait to see if the symptoms disappear. Don't drive yourself to the hospital, and don't try to sleep it off. But for the everyday sleep concerns we've discussed today, the message is much calmer. Pay attention. Your body may be giving you information, and sometimes the most useful thing you can do for your future health is simply stop dismissing a repeated pattern. So tonight, don't lie in bed worrying about stroke. Instead, ask yourself 3 simple questions. Do I snore loudly? Has anyone noticed that my breathing stops or becomes irregular while I'm asleep? And do I regularly wake feeling exhausted even after what should have been enough hours of sleep? If the answer to any of those questions concerns you, bring it up with a healthcare professional. Because getting older does not mean you have to accept poor quality sleep as your new normal. Your nights matter, your recovery matters. And protecting your cardiovascular health is not about being perfect. It's about noticing the things you can change and taking reasonable action before a small problem becomes a bigger one. If you've noticed unusual snoring, nighttime breathing problems, or unrefreshing sleep, tell me about your experience in the comments. And if this video helped you understand something about your health that you had been overlooking, consider subscribing. Because in the next video, we're going to look at another everyday habit that many older adults consider harmless, but your heart and blood vessels may see it very differently.